Evidence to action. What happens to data next? Data is created across people's lives. Data is fragmented, incomplete, and shaped by systems. So what happens to that data next? Where data goes. Once data is collected, it is stored in different systems. Schools hold education data, health services hold health data, government programs hold data about supports. Each system keeps its own records. Data is analysed. Some of this data is then analysed. It is used to create statistics and reports, track outcomes over time, understand how systems are working across education, health, supports, and ultimately reports. Data informs decisions. Data can be used to make decisions. It can inform policy, funding, services, and system design. It helps answer questions like what is happening, who is included, what needs to change. Gaps begin. But data does not always lead to action. We often see a pattern. Data already exists. Across systems, there is a large amount of information about people's lives. From this data, insights are identified, reports are written, recommendations are made, but these recommendations are not always implemented. Change is slow or partial or doesn't happen at all, and there is not always clear accountability for whether the change occurs. We don't always know what has improved, what hasn't, or why. Research opportunity. So the gap is not just in data, it is between what we know and what we do. For people with disability, these gaps have real consequences. When data is not used, people remain invisible, needs are not understood, and systems don't improve. And as we saw earlier, the burden often sits with the person. Remember Max? People with disability are asked to keep explaining their lives without systems learning from the data already collected. Role of research. This is where research has a role to play. Research can connect data, fill gaps, and make meaning from what we know. Research creates an opportunity to move from data to action, to strengthen evidence, improve understanding, and support better decisions. To go from existing data to insights through an implementation gap and accountability gap, and provide more opportunities for research. Data, data to action, evidence to action. Good data does not create change on its own. It needs to be connected, understood, and used. And this is how we move from data to action.